Place the transducer in a transverse orientation in the epigastrium, just below the xiphoid process. To visualize the left lobe of the liver, slide the transducer caudally in a slow, steady motion to identify the horizontally oriented major venous vessel, which serves as a landmark for the pancreas. Identify the anterior aspect of the spine. To the left is the short axis of the abdominal aorta AA, while to the right is the short axis of the inferior vena cava IVC. Anterior to the abdominal aorta lies the short axis of the superior mesenteric artery SMA. Anterior to the SMA is the horizontally oriented splenic vein SV. Its rightward aspect marks the confluence of the portal vein. The head, body, and tail of the pancreas lie immediately anterior to these vascular structures. The pancreatic neck is situated at the junction of the splenic vein and the portal vein. The pancreatic head wraps around the portal vein. Posterior to the superior mesenteric vein SMVM lies the uncinate process of the pancreas. The distal common bile duct CBD is located posterolateral to the uncinate process. For splenic scanning, position the patient for a standard longitudinal view to clearly visualize the splenic hilum. Utilize color Doppler to delineate the splenic vein main trunk as extensively as possible. The pancreatic tail is identified immediately anterior to the splenic vein in this plane. This window serves as an effective alternative for evaluating the pancreatic tail when it is obscured by gastric gas during a standard transabdominal scan.